Welcome to Psychominds. Here psychology is made simple, clear, and based on science. Attention is a fundamental mental process that allows human beings to selectively focus on specific stimuli while ignoring others. It is not a single function, but a dynamic system that regulates perception, cognition, and behavior. Without attention, the brain would be overwhelmed by the vast amount of sensory information it receives every second. Attention acts as a filter that prioritizes what is most relevant for survival, learning, decision-making, and social interaction. From a psychological perspective, attention is closely linked to consciousness because it determines what enters our conscious awareness. We are not consciously aware of everything happening around us. Instead, we attend to only a small portion of our environment. This selective nature of attention is essential for efficient mental functioning. For example, when reading, we focus on the text while ignoring background noise. When driving, we attend to the road while filtering out irrelevant visual details. In cognitive psychology, attention is described as a limited resource. This means we cannot attend to everything at once. Our brain must constantly allocate attentional resources based on goals, motivations, emotions, and external demands. If too many stimuli compete for attention, performance decreases, leading to distraction or cognitive overload. Neuroscience has shown that attention involves multiple brain networks rather than a single brain region. It integrates sensory processing, memory, emotion, and executive functions. This explains why attention is deeply connected to both cognition and behavior. Impairments in attention can significantly affect learning, social functioning, and mental health. Clinically, attention is considered a core mental function in psychology and psychiatry. It is evaluated in neurological and psychiatric assessments because disturbances in attention are present in many conditions, including ADHD, depression, anxiety, delirium, and brain injuries. Understanding attention is therefore essential for both scientific research and clinical practice. Attention is not a single ability but consists of different types that serve distinct cognitive and behavioral functions. Psychologists and neuroscientists generally classify attention into several main types: sustained attention, selective attention, divided attention, and alternating attention. Each plays a crucial role in everyday functioning. Sustained attention, also known as vigilance, refers to the ability to maintain focus over an extended period of time. This type of attention is essential for tasks such as studying, listening to a lecture, or monitoring a situation for changes. Deficits in sustained attention are commonly observed in conditions like ADHD and fatigue. Selective attention involves focusing on one specific stimulus while ignoring others. For example, having a conversation in a noisy environment requires selective attention to filter out background sounds. This type of attention is closely related to the brain's inhibitory mechanisms, which suppress irrelevant information. Divided attention refers to the ability to attend to more than one task simultaneously. Although people often believe they can multitask effectively, research shows that true divided attention is limited. In reality, the brain rapidly switches between tasks rather than processing them simultaneously, which can reduce efficiency and increase errors. Alternating attention is the capacity to shift focus between different tasks or stimuli based on changing demands. This is important in complex activities such as problem-solving, where one must alternate between reading, thinking, and writing. These types of attention are supported by overlapping but distinct neural networks. Understanding them is crucial for educational psychology, clinical assessment, and cognitive neuroscience. Impairments in any of these attentional systems can lead to significant difficulties in academic, professional, and social functioning. Attention is supported by a complex network of brain regions rather than a single structure. Key areas involved include the prefrontal cortex, parietal cortex, thalamus, and reticular activating system. These regions work together to regulate alertness, focus, and cognitive control. The prefrontal cortex plays a central role in top-down attention, meaning attention guided by goals and intentions. It allows individuals to plan, inhibit distractions, and maintain focus on relevant tasks. Damage to this area can lead to difficulties in concentration, impulsivity, and disorganized behavior. The parietal cortex is responsible for spatial attention, helping us direct attention toward specific locations in our visual field. It integrates sensory information and helps the brain decide where to focus. The thalamus acts as a sensory relay station, filtering and prioritizing incoming information before it reaches higher cortical areas. It plays a crucial role in determining what enters conscious awareness. The reticular activating system in the brainstem regulates arousal and alertness. It ensures that the brain remains responsive to important stimuli, such as sudden sounds or visual changes. Neurotransmitters also play a critical role in attention. Dopamine is associated with motivation and reward-based attention, while norepinephrine is linked to alertness and stress response. Imbalances in these neurotransmitters are associated with disorders such as ADHD and depression. Modern brain imaging techniques, such as fMRI and EEG, have confirmed that attention involves dynamic communication between multiple brain networks. This highlights the complexity of attentional processes and their importance for mental functioning. In clinical psychology and psychiatry, attention is a key component of the mental status examination, MSE. Clinicians assess attention to determine whether a person is alert, focused, and capable of processing information effectively. During evaluation, professionals may ask patients to perform tasks such as repeating numbers, counting backward, or focusing on specific instructions. These tasks help assess sustained and selective attention. Impaired attention can be a sign of various neurological and psychiatric conditions. For example, individuals with delirium often show fluctuating attention, confusion, and difficulty concentrating. Patients with depression may report mental fog and slowed thinking. In ADHD, attentional deficits are one of the core symptoms. Individuals may struggle to maintain focus, follow instructions, or complete tasks without distraction. Attention is also evaluated in cases of brain injury, stroke, or neurodegenerative diseases such as Alzheimer's. Deficits in attention often appear early and can impact memory and reasoning abilities. A thorough assessment of attention helps clinicians make accurate diagnoses and develop appropriate treatment plans, including cognitive training, psychotherapy, or medication when necessary. Attention plays a central role in many psychological and psychiatric disorders. Alterations in attentional processes are observed across a wide range of mental health conditions. In ADHD, individuals experience chronic difficulties with sustained attention, leading to problems in school, work, and relationships. Treatment often involves behavioral strategies and stimulant medications that enhance dopaminergic activity. In anxiety disorders, attention tends to be biased toward threatening stimuli. This hypervigilance can make it difficult to concentrate on everyday tasks and increase emotional distress. In depression, attention may be reduced or slowed, contributing to difficulties in decision-making and memory. Patients often describe their thinking as cloudy or sluggish. In psychotic disorders such as schizophrenia, attention can become fragmented or disorganized, making it challenging to process reality coherently. Understanding the relationship between attention and psychopathology is essential for developing effective interventions. Cognitive training, mindfulness techniques, and psychotherapy can help improve attentional control and mental well-being. Here on PsychoMinds, we explain psychology with clarity and scientific responsibility. Subscribe and be part of a community focused on learning and understanding the mind.